We are so excited to say that this podcast is sponsored by Watermans.
Wait, the solicitors?
Yeah, but they're not like regular solicitors, obviously.
So not super serious and complicated?
Yeah, I would say they're a bit more straightforward kind of vibe, our vibe.
I can get bored with that.
For straightforward legal advice, remember Watermans.
Hi guys, welcome back to A Lot on Your Plate. Happy Tuesday. You'll see that it's only me here today, but we do actually have a lovely guest joining us soon, Fiona from the Aesthetics Club, which if you've been here from the start, she's been on before. So round 2 with her today, talking all things skincare, aesthetics, product recommendations. However, sadly it's only me here because Jess lost one of her wee cats at the weekend really suddenly, so she's not up for chatting this week, which is understandable. So hopefully you'll all send your love and your well wishes and we'll just get right into it. Welcome, Fiona.
Thanks for having me.
Welcome back.
I know. Second
time round. Because everyone loved you the first time.
Oh, thank you.
You can't get enough of this kind of thing, can't you not?
Yeah, I feel the girlies love it.
Yeah, and you've got new updates for us as well.
Yeah,
that we need to talk about.
I know, we've got exciting ones for sure.
So first off, let's do a kind of brief intro about you, how you got into aesthetics, skincare, a bit about your background in case we've got anyone new.
Sure. Okay, so my name's Fiona. I'm the founder and clinical director of the Aesthetics Club. We have 3 clinics in the UK. So we've got 1 in London and then we've got 2 in Glasgow, and we are just about to open 1 in Edinburgh on Saturday. So I have done aesthetics now for 11 years, and I got into it after having my lips done. I did a course, and that was, a really long time ago. So I was 21 and I just really enjoyed the course, and I just thought, I don't know, it was a weird feeling. I just thought, this is going to be my job. I'm going to move into this. And at the time I was a nurse working in London at King's College Hospital, so I had a totally different job. And I was doing this course, and the woman running the course said, I think this is going to be like what you do. And I was like, oh, thank you. And flattered. And then I just started to do more and more training, more courses. And then my career moved into aesthetics. So I worked for lots of different people in London. And I worked at a private members club for quite a long time, which was really fun. So we would do quite a mixture of vitamin drips, aesthetics, a little bit still of practice nursing. So I'd still do lots of blood tests, smears, all of those kind of things. So it was nice because it kind of did a little bit of both. So I was really enjoying that. And then I was asked to interview for a job which was for the biggest cosmetic and aesthetic company in the UK as their lead nurse for London and for training up all of their nurses internally. So I moved into that role and really enjoyed it, and then started to train more and more people for an external company. And then it just gradually got to the point where I thought, I'll try and do this on my own and see if it works. I'll just do 1 day a week. And then, that got really busy really quickly. So gradually moved into renting space in another clinic and then having my own clinics. And then in 2020, my husband and I moved back to Glasgow, and I thought I'd better do some
back to the motherland.
Yeah, dragged him here. So then we were in Glasgow, and it was lockdown. It was kind of a weird time, and I thought, right, we better open a clinic here because I was still going down to London loads to see patients there. So opened the one that we have in Bearsden, and then Bearsden was really busy really quickly, which was lovely. And I thought, right, we need more space in Glasgow. And I looked at either moving Bearsden to a bigger location, but I thought, why don't we divide and conquer? So we opened in Newton Mearns, which is great, kind of being on both sides of the city.
Yeah.
So that's working out really nicely for us. And then I've got a clinic in Notting Hill, which I'm at every second week. And then on Saturday, we open in Stockbridge in Edinburgh. So that'll be fun. I'm excited to be there.
No one can stop you. It's just go.
A ill toddler stops me often, so but no, it's good. Yeah, it's really busy, and the team is growing and they're all amazing. So I think there's 22 of us now. So a really big team, and lots of nice people, keeping everyone looking fresh faced.
Lovely. And if anyone hasn't made the connection, Fiona's who me and Jess go to for our botox and our facials and the famous Hydra facial.
Yeah, they're easy work. You guys are easy work.
So for anyone who calls us shiny, it's not shiny, it's glow. It's glow from Fiona herself.
We work hard to get that.
So what kind of treatments can people expect to see when they look on your website?
So we do lots of different things. We do injectables, which tend to be your botox, your filler, your skin boosters. So when we think of skin boosters, the 2 brands that we use, one is called Amila, which is a polynucleotide. So that's going to really help to, it's what we call a biostimulator, so teach your cells to make more collagen and elastin. And we can use that in different areas to improve skin quality, to make things tighter, brighter, plumper and fresher.
Neat.
Yeah, it's so good. I love it. We do such a huge amount of it now, actually. And I absolutely love it. I think it works so well. And then we also do a lot of Profilo, which lots of people know, so that's more of a hydrating product. So really nice to get that hydration, plumper, glowier, dewy skin. So it's coined an injectable moisturiser, so that is really what it's doing. It's adding hydration in there. So we do lots of different types of injectables. We do lots of filler. That could be volume replacement, profile balancing, lip enhancement, all the usual things. And then we have lots of different machines. So the machines vary from clinic to clinic, but we do a lot of Morphus 8. So that's really good for tightening up the skin, making everything a little bit sharper, a little bit more contoured. Really, really good for patients sort of a little bit older, 40s, 50s. Works really, really well. And then we also do a new machine, which no one else actually has in Scotland, which I'm absolutely loving. So there's 2 different parts of it. One is called BBL Hero, and that works on pigmentation, redness, vascularities of the skin. So really, really good to get that flawless, filtered looking complexion. And then Moxi is a non-ablative resurfacing treatment. So it resurfaces the skin, so great for texture, fine lines, tone, but it doesn't have a huge amount of downtime with it. So you'll be red afterwards, but that redness will go by the next day, and then your skin's kind of dry for about a week afterwards, but nothing too extreme. I've had it and I was like, this is so good. The difference is incredible to the texture of people's skin's amazing. We're doing a lot of it now for acne scarring, and the results have been so good. So that'll be in Edinburgh, and that's in Newton Mearns as well.
Lovely.
I know.
You just get everything.
I know. And then there's lots of facials as well, all of our usual facials. So we do hydrofacials everywhere, and then we have our signature facials as well. And we have a new machine, which I love, called the Oxylight. So I really, really wanted this. I saw lots of people getting prepped for the Oscars and using it. I was like, what is that machine? How can I get that? I need that. How do I get that here? And the more I researched it, I saw in the UK hardly anyone had it. It was only in Harrods, the Rosewood Hotel and the Bulgari Hotel. And I was like, oh, don't know if they're going to agree to come to Glasgow. But anyway, we managed to get them to agree, which was amazing. So that's in Newton Mearns and in Edinburgh, and it will be in all clinics eventually, but the results are incredible. So it's a 6-step facial, and it really targets anti-aging concerns, so great for plumping and lifting. Like, you treat one side of the face, and when you're looking down at your patient, you can see how sculpted and lifted they are.
Love that.
And it's great. They do dermabrasion in it as well, and really, really strong lymphatic drainage, so you feel really sculpted afterwards. Really, really, really lovely. So that is new and really exciting. So that's a good one to get.
If I had endless cash,
I know.
I'd be a different person.
Yeah. You could be in every week. I know. Try them all.
So enjoyable as well. Like, that's what I like about your clinics. They're relaxing.
Yeah.
But even though a lot of your treatments are very like results driven, it's not clinical.
Yeah.
Do you know what I mean?
I wanted to have like the real medical expertise, but I didn't want it to feel, I used to work in these clinics in London and they'd be really fancy, but people with loads of money were coming in and still kind of feeling intimidated coming into the space, and I thought that's not what anyone wants. No one's going to want to come back to that. So I wanted to create something that felt really welcoming, really fun to come into, but still really professional and results driven. So my other thing was, we used to do like all these medical treatments, and you'd be in like this freezing room lying with all your clothes on. I thought there's no reason we can't like combine that with how a spa treatment should feel.
Yeah, exactly.
And make it feel really special and still feel like a treat. So yeah, I feel we've done that
the
nicely.
bed's so cosy.
I know, it's so nice, isn't it? I love like getting in there. Oh, what a treat. I know.
Cozying in.
Oh, it's so nice. I know. I'm like, I can't do any more work now.
Anyway, our listeners had so many questions.
Great.
For you, obviously. So I've split it into like aesthetics and treatments, and then skincare after that. Yeah. So first one, which is a big one, advice for anyone wanting those sort of tweakments but not sure where to start.
So I would say always start with a consultation. I think like we have that a lot. People come in and they're like, I feel I want to do something, or I feel I look a bit tired or run down or whatever it may be, but I don't really know what the right thing is. So definitely have a consultation, even have a few consultations with different places and see kind of what feels like the best fit for you. But we would always do an injectable consultation and we'll tie in a skin consultation with it. Sometimes it's just that they need to invest more in the skin side of things rather than the injectables, and I think it's really dependent on age, budget, and sort of what they're looking to change. So we'll normally start with a consultation. I always say to people, tell me what bit you tend to focus on, and then we'll normally build a treatment plan from there. So most people will say, like, what's these lines here, my makeup sits in them, or around my eyes, or when I'm smiling, my lips seem to be getting thinner, and then, that'll give us a good indication of where we're going to go. But I think don't rush it, don't do it on a whim, have a consultation, don't do anything that day, go home and have a think about it, and then go from there and book it.
Yeah. So for Botox then, how do you know when it's the right time?
So if we're thinking clinically, we're looking at lines in the skin that are there at rest, so them not disappearing. So I always think forehead's a good one because everyone can think of them. So if you've got horizontal lines on your forehead that are sitting in the skin at rest and sort of you feel your makeup sitting in them, it could be time to think about doing some Botox. People often ask, like, should I start doing this preventatively? But Botox works so well, it's so effective. So if you're early 20s, you don't really need to be starting to do that. Wait until you're starting to be bothered more and more by those lines, and then it's time to think about it. In terms of ages, it varies. It depends sort of on people's skin quality, sun exposure, how good they are with SPF and skincare, all of those things. But I would say kind of late 20s, early 30s is usually the time that people go for it. We do have some people that are younger, and if it's clinically indicated, that's fine, but it's not something I think if you've no lines, start doing. There's no need to. Save your money, spend it on skincare and facials, and then you can get the
do it down the line
stuff when you need to.
I actually got my Botox the first time quite young, but I needed it.
I was the same. I was 24 when I had Botox for the
I
first
think
time,
I was 24 as well. And when I went, the woman was like, yeah, you do need it. And I thought,
and I think,
how long have I needed it for? Because now I've got complex.
Yeah, I know. And I think once you've had it, then you're like, oh, I really did need that. But I think as well, like I don't know, I was doing all the right things with skincare, but I think I must have had a really expressive face. It was more it was just my forehead. That was the only bit that I was like, oh.
Yeah, it was. I had a frown line, which makes a lot of sense for me. I'm sure everyone understands why that would be. So a few people asked about the pain.
Yeah.
Of injectables. Obviously it's different for everyone.
Yeah.
But is there any way you can explain it to almost like settle people's nerves?
Sure. So I would say Botox is really minimal. I would say it kind of feels similar to like plucking an eyebrow hair.
Yeah, I agree.
With pain. It's not bad at all.
Yeah.
It's little tiny scratches and your treatment is over with in a couple of minutes. So it's not anything that's too bad. Other injectables can hurt a little bit more. So lip filler is always the one that people think about that is going to be a little bit more painful. When we do lip filler, we use a really strong numbing cream, and then we also use a 4mm needle, so the teeniest teeny little needle that you can use, and that makes a huge difference. So I think it really depends who's doing them, what technique they're using. All of those things definitely play a part, but I wouldn't say anything's unbearable. In 11 years, I've never had anyone say, stop, that's too sore. I can't cope with that pain. I think more it's as adults, people aren't very good with anticipated pain when they know it's coming.
The nerves.
The nerves kind of get the better of them, but I don't think anything's too bad at all. Morphosate's a little bit spicier, and Moxi. Actually, Moxi's not too bad. It's okay, actually. I was thinking.
Yeah, right. Okay. It's the waiting, because the first time, like you do the needle for the Botox, like I jump, but then after that, I actually quite like it.
Yes, I know people are like, youthfulness is coming.
Also, pain is beauty. That's just part of life.
Totally. I don't think it's anything too bad. I would say like getting your upper lip waxed is way worse than a lot of it. So,
bikini wax, nothing will top that for me.
Definitely.
That's a one-time thing for me.
a one-time thing. Waxing is way, way worse, I would say, than anything that we do. So,
okay,
nothing is too bad.
I have heard that dissolving your lips is worse than getting them done.
I would say, do I think so? It depends. I think it's probably a little bit stingier, but often with dissolving, you don't use a numbing cream because numbing cream makes you swell. So you don't use a numbing cream because you want to make sure that you can see exactly where the filler is.
Yeah.
So I don't... Do you know, again, I use a Botox needle to do dissolver, so I don't find my patients think it's too bad, but I have had patients that have had terrible experiences elsewhere. So I don't really know. I don't know what they are doing to make it so bad, but it shouldn't be anything too terrible.
hopefully that helps a lot of people and they'll get booked right in.
Yeah, absolutely. No, it's nothing too bad.
What's your thoughts on dermaplaning? A lot of people doing it themselves now at home.
Yeah, so dermaplaning I think is fine. I would say if you're doing it at home, make sure you're using like a clean blade every single time you do it. Single use, get rid of them. And just be careful you don't cut yourself. But I think with dermaplaning, we often see a lot of people have breakouts afterwards, and I think it's more the products that people put on afterwards. They put on something too active, and you have given your skin a really good exfoliation with dermaplaning. You're taking off that top layer. So I think when you're doing that, you just need to be really mindful of what you put on afterwards. Make sure it's only like a hyaluronic acid or something calming. Don't put loads of vitamin C and actives on, because otherwise you will start to get breakouts. It's too much for your skin to kind of do all in one go. So dermaplaning's fine. I used to not love it too much, but I feel since I had my son, I'm like, great, he's given me a beard as a gift. So I definitely do it more. But I think a lot of it is just being mindful that you're using a clean tool every single time you do it, and if people incorporate it in a facial, then great. You'll be in safe.
Because I have a really hairy face, so I have had it done a couple of times.
Yeah, me too.
But then I just don't know if it comes back. Do you
know.
think it comes back more or not really?
No, like when you look at the science of this, it doesn't actually come back any thicker. But I think what makes people feel like it is because you have that really stubbly stage, whereas normally you just have that soft peach fuzz, and that doesn't really feel like hair growing in, or like you don't feel as aware of it. But when like you do have that kind of stubble, you think, cool, new beard.
I'm lucky that I've got light hair, but see when it catches the light, like my whole face is covered in hair.
I'm the same. Yeah, I've got a really fluffy face.
I could pull it off.
Yeah, I'm the same. Yeah, I could pleat mine. I think mine is,
And it was actually Jason that said to me, it was earlier on in the year, he was like, how hairy is your face? And I thought, why did you say that to me?
Don't bring this to my
attention. Then I shaved it off.
Yeah, mine seems to get really bad after second baby. Like I had a full-on beard. Mine was, and the first time I dermaplaned at home, I was like, oh my goodness.
Couldn't believe how much
I could have made a wig. I was like, wow, this is a lot.
Right, a massive subject obviously is hormonal acne and breakouts.
Yep.
Which, if anyone's watching, I have one. And it has to be on this side, couldn't it just be on that side? Anyway, so what kind of treatments would you recommend getting and avoiding if you suffer from acne or you're trying to help it?
Yeah, so there's loads that you can do, and I think there's also times with acne that you should do absolutely nothing. And just let your skin kind of reset and calm down a little bit. So I would say hydrofacial is great if you've got breakouts. It's going to help to get rid of all those impurities, put hydration back into the skin. But a big thing with acne is all your products need to be oil free so that you don't get more breakouts. And hydrofacial's a great option. I normally say to patients, come in for that first and then we can work on a plan. With more severe acne, we'll often do, like BBL has a treatment that we can do with it for acne, which is amazing. And you do six sessions of that over over 6 months, and the results are great. But that would be if you had more severe acne. Also, we can do lots of different types of peels, but again, it depends kind of where you are. If you've got mild acne, then we're going to look at doing like mandelic peels. If you've got more severe acne, we're going to look at doing salicylic things. So we're going to kind of up that as need be. We'll always look at people's products as well and see what they're using. Hormonal acne can be really tricky because you're doing all the right things, and then your period comes again and your skin starts misbehaving. So it can be really difficult to get on top of, but we can also look at prescribing medications or referring people to dermatologists if need be. So there's loads of options there, but I think simplifying what you're using at home is really key. Even like using like LED masks and things like that at home, that'll bring down the inflammation. In terms of your products, glycolic acid, salicylic acid, niacinamide, all of those things will really help at home.
And are you for or against Roaccutane?
I would say I am for Roaccutane. I think it can be life-changing, but I'd say that with a huge amount of caution around it, because it is a really intense drug to be on, has a huge amount of side effects. But now, so with Roaccutane, that can only be prescribed by a dermatologist. So if you see your GP, if you see me, we'll always have to refer you. So you are in the safest hands with it. But now I think the dosing is better. You're not put on such a high dose. People used to be on a much higher dose initially and kind of was a bit more blanket, where now I would say it's a little bit more tailored to that patient's needs. So Roaccutane is great, but it can be quite an intense drug to be on. There's another drug that's used quite a lot now called spironolactone, which has similar effects to Roaccutane but doesn't have as many side effects. So if you are thinking about getting Roaccutane, always ask if you could be put on that and if you're a suitable patient for that. So I do think it is good, but I think it's something you have to really think about going on. But I think I used to do a clinic in London for a company that I worked for, and it would just be acne patients that I'd see all day, and the effects that acne can have on people and and on their confidence. I just think like it is really, really hard, and it's like heartbreaking. The majority of them are sort of teens and early 20s, and you know, they don't want to leave the house because of it. And I think if you're at that stage, it's a really good thing to look at and something that could really, really help.
Because I went on it when I think I was like 22, because I got adult acne, and I'd never had spots really throughout school or anything, so I was like, where has this came from? And honestly, I shout about it from the rooftops, but I know I was lucky. I didn't really suffer from side effects. I did have like a dry bloody nose. I didn't have nosebleeds, but I had like, as if before it dripped, it just dried up. I did have dry lips, but it was bearable.
Like manageable.
Annoying things like, for girls, like fake tan doesn't go on the same, because your skin's obviously just different and everything's dry. But I think you're right. Like, I remember I was only on it for 4 months and it worked wonders, but my dosage went up ever so slightly each time, so they're not flinging you in at the deep end anymore, which I think that's what you used to do.
Yeah, totally. And I think that's it. A lot of people will go on it once and they won't have to go on it again, which is amazing. So I think if you fall into that camp, which is, it's high, I think it's about 60-70% of patients will use it once and then don't have to do it again. So that's amazing if you can fix that in one go, and you sort of think, right, I'm going to have to do this for 4 to 6 months, and then after that,
worth it then.
I'm not going to have to deal with these skin concerns anymore. Then I definitely think it's worth it.
I have went through periods of time since then that I've thought I would love to just go on that again, like, because I'm having like a bit of a breakout. But I don't know, it's just not easy enough to get.
That's
like, to just decide, I want to go on that again.
And I actually think it's a good thing. It's not because it's something you have to, you know, have your bloods done, have liver function checked while you're on it, and you need to kind of commit to being on it. You need to sign forms to say if you get pregnant, you will have a termination. Like, you can't drink on it. There's loads of things to think about.
Like, it's like a deep drug.
Totally, it's really, really strong. So I think it is good that it's something that's quite hard to get your hands on. And there are other things that we can use before that, like kind of do stepping stones. There's a drug called limacycline, which we normally start with, and then we can increase as need be.
So what about for scarring then? What sort of treatments would you recommend for that?
So when we think about scarring, you have to think about damage for repair. So we need to basically make your skin register trauma in that area. So it's going to make your cells create lots of collagen and elastin, and then we get that like, if we think of like pitting and scarring, we get that fresh skin coming higher and higher and higher. So there's lots of different things we can do, and again, it'll depend on the severity of the scarring. So that can be just Dermaplaning and peels. That works really, really nicely. And again, with scarring, sometimes we're only looking at discoloration. So you have that hyperpigmentation, like post-inflammatory hyperpigmentation after acne, and it's like when you've got redness, but it's not a spot anymore. It's just marks. But that can be just as annoying. It still looks like a spot. So with that, if it's redness, like mandelic acid's great for that. That helps to reduce that really quickly. Same with Dermaplaning, that's going to cause a little bit of damage. You get that real surge of collagen and elastin, and that skin helps to repair itself quite quickly. And you would do a couple of sessions of that over a couple of months. If that's not going to be enough, then we would look at doing morphosate. We can do resurfacing with that. And then also with moxi. I would tend to go for moxi now. I think that's faster at getting you the result. And you would do 3 sessions over 3 months, and the results are really, really good for that. But anything has to be what we think of something that's going to cause damage to the skin, which kind of panics people when they think, I've just had all this acne and I've just kind of got to a place where I don't have breakouts. But that's what we need to do to get an end result. If we need something more extreme, so if someone has really, really bad scarring, then we would look at like a CO2 laser, an erbium laser, which is going to completely resurface the skin. That's a lot more intense, a lot more downtime. You're thinking kind of 3 weeks of downtime, and then being pink for about 9 months. So it's really severe, and it's a big commitment to do that. But again, the results can be worth it.
And it is the worst having the marks, because even after I came off Roaccutane, I feel like I woke up one day and the marks were gone as well with it, because it does like help that too. But even now, like, I'm such a picker.
It's
I
hard.
will pick until, honestly, my skin's literally gushing.
Yeah.
But I just can't help myself.
Yeah, I know some people, honestly, we have patients in a lot and we're like, did you pick this? And they're like, no. It's hard. I think it is really difficult. And if you have a spot which has a head on it, or like a yellow head, it's difficult not to get rid of that. And you can get rid of that safely. But if something doesn't have a head, don't squeeze it until, you know, your skin's bleeding. You're not getting anything out of it.
I know.
It's just you're just making it worse. And in terms of that healing, it's about 10 times longer for that to heal. So it's not worth doing. I know it is really hard.
I just physically can't stop my hand.
I know you're like
from going up, and like it's actually horrible. Like, see if it's the deep ones that don't have a head, but you can feel almost like the ball in your skin. I can't help but like poke at it and prod it and squeeze it and hope that something comes out. It's disgusting.
I know.
And I would do it to anyone that asked me to as well.
Oh, that would be my dream job if I could just like
Dr. Pimple Popper, me too.
Things all day. I'd love it. But
I'm the same. Love it.
It's try not to pick. I know it's hard, but try not to pick, or go and see someone and they'll help
extract for you in a safe way.
Yeah.
Which I do not do. Wedding prep.
Yeah.
A lot of questions on that. What's your kind of go-to advice for someone?
So we do a huge amount of brides, which is lovely, and their treatment plans will range from skin treatment, so we'll normally do a course of facials, and then some brides will want to do injectables as well. So when we're thinking about a wedding, again, it depends kind of the quality of your skin on the run up to your wedding as to when we start. So if we're thinking about something like scarring, we want to see you sort of 12 months before, so we've got loads of time to get on top of that. If we are just thinking about someone with good skin who wants to do some facials, we can see you 6 to 3 months before, and we can do some bits then. But the majority of our brides will do some botox, so some anti-wrinkle injections. They'll do a course of facials. So we normally do some hydrofacials. We do a facial called the baby face, which is amazing. Your skin is so glowy and dewy, and we try and do that one as close to the wedding date as possible. Your makeup will go on so nicely and your skin will look amazing. So we'll kind of vary the facials depending on someone's skin concerns and how their skin is looking. So it depends sort of their goal, and we'll make that custom to whatever they want to achieve. A lot of our patients will also do a Mila or Profilo, so some skin boosters. A little bit of lip filler is also pretty popular for brides. We never have brides that want to change a huge amount about their face. It's not that we'll do loads of filler or anything like that before a wedding. Sometimes a few little tweaks, but it tends to be people just want to look their very, very best. So I would say come and see us with quite a good amount of time, just so that we can get a good plan in place, and then we can work through that on the run-up. And we do loads of bridal packages, which help people save a bit of money on the run-up.
Yeah. So do you think if you are getting married and you just don't know what you would need, maybe getting in touch a year before so that you can either advise we should start now or come back in 6 months? Yeah,
absolutely. We have loads of brides that are like, I just want to do, say, 3 facials on the run-up and I want to do a little bit of Botox, but they're really organised and they'll come and see us a year before, and I will say, just come back, we'll book it in for 6 months' time and we'll see you then, and you don't need to think about it.
Yeah.
And then sometimes we'll have people come in who have quite problematic skin, and then I think, great, we've got 12 months to play with here, so what we'll do is start to book in facials every month and really get on top of their skin before their big day.
That's quite a stress.
I know, and often it is as well in the run up to wedding when your skin misbehaves the most
because you're stressed.
You're a bit more stressed out. But most of our brides, I mean, they all look amazing on the day anyway. And
I know, all brides do anyway.
Yeah, I had a panel talk recently and they were asking, like, what do we do if we wake up and we've got a spot? My thing would be, don't squeeze it, because your makeup artist will work wonders on it anyway, so just leave it. And it's much, much easier to cover a bump than to cover a scab. So just leave it alone and your makeup artist will sort it.
That would be tragic if it was me, because I'd be like...
I know.
And then it almost swells your face because you've been prodding it, and it does look worse.
Yeah, poking and prodding it. So
I'll never learn.
The best thing is leave it alone.
Never learn. What about treatments for pregnant women? Is there still things they can do, treatments they can get?
Yeah, to an extent. So you can't do any injectables when you're pregnant or when you're breastfeeding, and you can't do any of the stronger lasers. But what you can do is really, really lovely facials, which will still be effective and really, really work on your skin quality. So one of the new brands that we have is Biologique Recherche, and we are the first people in Scotland to have that.
Love that for you.
It is amazing. It is so, so good. So we do incredible facials with them, and they are pregnancy safe. We also do a facial, which is the Intrathecals oxygen facial, and that uses hyperbaric oxygen therapy to push the products deeper into your skin. So really hydrating, really nourishing. Both of them are pregnancy and breastfeeding safe, and are really nice treatments to have. They're super relaxing, really nice gifts to give as well, if someone's expecting.
Yeah, it's a nice gift. It's quite hard to buy for like the mama.
Yeah, we've got lots of people that will do that, or like maybe it's like second baby or third baby.
Yeah.
Like we've already given her other stuff when it was her first kid, so we want to give her like a treat for her. So yeah, that's really nice.
And after, when you're a new mum, when can you start introducing injectables and different treatments again? Is there a certain amount of time you should wait?
So I always think give yourself a bit of time. Like anyone who's had kids will know that feeling of post-baby, you do not feel like yourself at all. So I think it's actually not the best time to go and change something or get something done. Give yourself a couple of weeks, couple of months before you're making those appointments. When I worked in London, there's a private hospital, that a patient of mine was having a baby at, and she was like, could you just come after I give birth to the hospital to do my botox? I'm like, no, you can't do that. Give yourself a bit of time. Technically, you can have injectables as long as you're not breastfeeding any time after having a baby.
Yeah.
But I'd say just give yourself some time, let everything settle. You've got so much fluid retention. Your hormones are all over the place. Don't change anything about yourself. Just give yourself a bit of time.
Yeah.
Wait till you kind of feel like you're a wee bit closer to the weight you want to be at as well. Like if you're doing fillers and you're not quite at the weight you were at or the weight you want to be at, it can make you feel worse, and it makes things feel a little bit off balance. So I always think give it some time, but technically you could do it any time after having a baby, but a couple of months, I'd say.
Yeah. No, that makes sense. What about acne?
Yep. So acne is acne on your back, and some people can be really prone to it if you do loads of exercise, lots of sweating and things. If you're a thick tan, you can find you get more breakouts on the body. So back and chest tend to be the places that they occur the most. There's no reason why you can't use your skincare on your body as well. So use like the Zoe exfoliating wash. That's great for back and chest. You can use that. We also do a clarifying back treatment, which is with Hydrofacial, and they have a big body tip. It's amazing, and that works really, really well. You can do it on the arms as well, and it's amazing. So that's a nice thing to do. We have quite a lot of guys who get that done, and the difference is huge. So
loads of people still suffer with acne that I know as well. Like it's hard to get rid of.
Totally. So, and it tends to be quite big sore spots as well. So, no, you can use products on those areas, and again, you could go on medication if need be, and it'll work the same way as it would for treating acne on the face.
I think you just wouldn't think, I could get Roaccutane unless it's on your face.
Totally.
But I actually do know a few people that have had it because of acne as well.
Yeah, absolutely. We've had lots of patients that have a really severe acne on their chest, and it does get on top of it.
The chest is sore as well. When you get a random spot or something on your chest, it's quite thin there.
Yeah, it's not where you want it.
I just think it's weird you wouldn't wake up with them on your leg.
I know
Maybe some people do get the odd thing, but you wouldn't get like acne.
It tends to be more of like an ingrown hair or something that causes the spot there. But I know, I always think that, like, why can't this be somewhere hidden that no one, like on my knee, that no one's going to see?
Yeah.
Totally.
Just acne on your one knee.
Yeah, I'm like, I'm fine, can cope with that.
Right, Zoe, I've got a scenario for you. You're in a car crash. It's not your fault. Your car is in bits and you're majorly stressed out. What are you going to do?
Probably phone you.
Great. Well, maybe don't do that, but the correct answer is to call our friends at Waterman's, obviously.
What, so they can sort my car and everything?
Yep. You don't even have to phone your insurance company. Waterman's will sort it all for you.
What if I have to miss work and can't earn my money?
Well, they'll get you that money back too. Sorted.
Okay, I feel less embarrassed about being rear-ended now. Someone actually asked, and it's quite an interesting question because I did see it on Olivia Atwood's programme.
Yeah.
And it's like vaginal
rejuvenation,
treatments. Do you do that?
Yeah, we do.
Do you get a lot of people in for that?
Yeah, quite a lot, actually. And a lot of it tends to be, I'd say there's like a couple of categories. People post-baby.
Yeah.
Then we get quite a lot of people that do a lot of exercise, a lot of runners. And then we have people that just want to make things feel
nicer
better.
Down there.
Yeah, exactly, which is great. So we do a treatment which is called Forma V, and so Forma is radial frequency, and you also have Forma, which is just for the face, and Forma Body, which is for the body. So radial frequency is going to help to promote collagen induction. It's going to help to tighten up the skin, and it's doing exactly the same internally. So it's a little wand that we insert into the vagina, and you move it in like a half moon motion. And then,
Yeah, that's what's on that programme.
yeah, it's so good. Like, the results are amazing, and see women who have a weak pelvic floor, especially after having kids, like that, it makes such a difference.
By the way,
You don't
I'm not going to book in me tomorrow for this, right? But I have really bad bladder issues. I wonder if I need that.
Yeah, like, it helps so much because it's tightening everything up and stimulating that area in the exact same way. So it's great. We've had such good feedback from it, and you know, people sometimes are like, "Oh my goodness, you do my Botox. I can't let you do that." And I'm like, I'm a nurse. I used to see naked people all day, every day. Like, you really
I know, you
don't
just
care.
don't look at the way you think you do.
I really can't tell you how little we care. So, you know, everyone who does the treatment is medical, and they all are like, yeah, we are not bothered. And what we tend to do is we'll do the treatment for half an hour. We like put on a podcast, chat away, and once it's inserted, you have a towel over you. Do you know, it's not like you're lying like legs akimbo. So it's not anything to be like embarrassed about coming in for. Totally. And it's not sore to have. In terms of feedback, everyone says it just feels warm, weirdly. So, but not painful at all. So, really comfortable to have. You have 3 sessions, and then what we tend to do is bring you back every year just for a maintenance session. But people that run, like, we have some patients that run marathons and ultra marathons, they're like, it really changed my life. Like, I don't have to wear a pad when I run anymore, or I'm not sneezing and wetting myself. I can go on a trampoline with my kids, like all of these things. So I think it is something that's really impactful.
Oh, to be a woman.
I know, all the joys, all the fun things that we get.
Right, next up, skincare.
Yep.
People need to know a bit more about the skin barrier.
Yeah, I agree.
What it is, how to improve it, how to know when it's damaged, things like that.
Sure. So your skin barrier is the outer layer of your skin. It's called your stratum corneum. And so it's made up of cells and fat is the best way to think of it. And what its job is to do is to keep all the hydration in your skin, to keep all those nutrients in your skin, and basically to keep your skin safe. That's the skin's job. It's the most outer layer of the body, so its whole job is protection. And when that's damaged, that it can be damaged lots of different ways, through overexfoliation, use of the wrong product, sun damage, stress. It can be damaged due to medications that you're on that's in the skin, loads of different things. Things like Roaccutane as well, that's going to decrease the skin barrier's effectiveness because it is such a drying product. So lots of different things that can damage it. Most people notice it's damaged when they start to use a product and they're like, oh, that's stingy when I put that on. So that's normally what we hear people say, that something was getting put on my skin and it felt stingy. So you know that something is compromised there. In terms of strengthening the skin barrier, there's lots of different things you can do, but I always think treatments that are going to, like Dermaplaning, moxi, all of these things that cause a bit of damage to repair, in the long run, that's improving your skin barrier. It's making it thicker, more collagen, more elastin, and it's going to make it tougher. So something like that works really, really well if we're doing treatments at regular intervals. Your skincare is obviously paramount, so make sure you're using lots of hydrating products, really nourishing products. You want products that are full of like fatty acids and ceramides. That's going to help to strengthen it. Things that can be a bit of a grey area, I think, with the skin barrier are retinoids. So people are like, you're telling me to use a retinol and that my skin's going to get better with a retinol, but it's sore, it hurts when I put my moisturiser on, and I don't feel I'm quite getting there, which is a tricky kind of point. And retinol does make your skin stronger, and it does help with collagen production, and it does make it healthier, but it's a real journey to get there. So you need to start really, really minimal and build that up. And as soon as you start to feel your skin's getting a bit compromised, you pull back on usage, and then we gradually increase again. So it is something that takes a bit of time, but I think retinol is something that people often get really confused about, or they'll use loads of it and they don't really understand the process of it. So something really educating your patients and letting them know how small to start that dosage and then to build it up. So your skin barrier is super important. If it's damaged, you're going to be like, that barrier's helping against aging, so you're going to be prone to more aging if that is damaged and it's not getting repaired. So stress is another thing that really affects it. So make sure you're working on like hydration, good skincare, good treatments, and after that then I'd say your retinol one, just be careful as to when when you're using them and when you increase it.
Okay, got it. Product wise, what would your advice be to people who don't really know what products to use, and if they've maybe bought a cleanser, a moisturiser, a toner, a serum, how to know what order to use them in?
So I always think like a good rule of thumb is start with your thinnest product first and then work your way up. So do your cleanse, always do a double cleanse, and then start with your thinnest product and then work up to your thickest. So you normally want to start with the serum first and then put on your moisturiser, and then put on, if it's the morning, put on your SPF and then put on your makeup. If it's evening, you want to start with your serum, or you want to put your retinol first. So again, retinol always changes everything. But you want to cleanse, put your retinol on first, then you want to wait about 20 minutes before you put anything else on. So don't let her straight away. Give that a chance to really work. So I actually tend to do it when my kids are in the bath, wash my face, put my retinol on, and then when I go to bed, I'll put on my moisturiser. So with that, you want to start small in terms of thinnest product, and then it tends to be your little amounts that you'll use, and then increase up to a thicker product, so your night cream or your moisturiser, and then your eye cream on top.
Makes sense.
Yeah,
it's a lot to remember.
I know it is, but I also think like I'm not a huge fan of like an 8-step skincare routine. I think like you don't really know what is working and what is not working then if you're doing that. So I think keeping it concise with high quality ingredients actually works much better. You'll get a much better outcome.
That's what a few other people asked as well. Like, what would be your non-negotiables for a quick and simple routine? You know, people with kids or a really busy schedule don't have as much time to have that sort of like self-care hour at night. Yeah,
so I would say like you want to have a cleanser. You want to have you could do cleanse, moisturise, SPF. That's your most important bits. Normally what we are trying to put in there as well is like a treatment product, so something that's going to work on a concern, whether that be like an anti-aging product or a brightening product. There's normally something that we're going to be slotting in there that's going to work on an issue that you have with your skin. I tend to do in the morning, so I would do a cleanser, then I would do my vitamin C, then I would do a moisturiser, then I do my SPF. And I think, great, that takes me 2 minutes to do. We also get lots of questions all the time in clinic, like, oh, can I not use my cleanser in the shower? The reason that people are told not to cleanse in the shower is people tend to have really hot showers. Just turn your shower down a little bit and cleanse, and you're not using boiling hot water on your face. Okay. So you absolutely can do that to save a bit of time.
Cleanse in the shower?
Yeah, that's fine to do. See, just as long as your shower's not...
It's just really, laziness.
Really hot, then fine. But people ask me that all the time. So yeah, you can absolutely do that to save a bit of time. In terms of people often ask, like, where do I invest and where do I save? I would say, again, it kind of depends what your skin concerns are. If we're looking at acne, then I would say invest in a really good cleanser, and then we're going to invest in a good treatment product, but save on your moisturiser. It doesn't need to be anything fancy, it just needs to be a hydrating one. Cetoplast Balm's a really popular one, and also the Aven Hydrator. They're both great, and they're really minimal in terms of what they've got in them. Something like that is perfect. But if we're looking at like anti-aging or say pigmentation, you'll invest more in those products, and then you can kind of sandwich in with things that are a little bit more reasonable.
Makes sense. I love that La Roche-Posay one.
It's great, yeah.
I can't say the word that you just said, that what it actually is, but I love it. So you put a thick layer on before bed. Feels great.
Yeah, it is. Everybody loves it. It's good.
Retinol, I know we've touched on it slightly, but when to know if you should be using that, or should everyone be using it to an extent?
Again, I think it kind of ties in with that, like when you're seeing the first signs of ageing and when to introduce it. So again, we're maybe thinking later 20s, early 30s, unless like retinol can be used as an acne treatment. So you could use it if you were having breakouts, and it works really, really well. But with a retinol, the key is small introduction, so using small amounts once to twice a week, and then just gradually increasing that. And ideally we get to nightly use. Some people don't get to nightly use, and some people do just find it too much for their skin. If their skin is compromised and they have a damaged barrier already, it's a harder thing to get used to and for your skin to really tolerate. So some people don't love that, and that's absolutely fine. There's other products that you can use, or you can invest more in the treatment side of things rather than products. So I don't think everyone has to use a retinol. I think most people who use it correctly end up loving it and really notice the difference in terms of their skin quality. With anti-aging, retinol and SPF are the only two products that are clinically proven to be anti-aging, so they're
Okay.
reversing the signs of aging, whereas other things can be clinically proven to like stimulate collagen or do other things, but these are the only two products that are actually really helping with signs of aging. So they're good things to be using, good things to have on your radar, but not something that is always essential for everyone.
Okay, makes sense. And pigmentation, sun damage, does retinol help with that too, or is there other things that we can be looking at for that?
Yeah, there are. So you want products that have like a tyrosine inhibitor is what it's called. It's something that's going to help to reduce pigmentation or reverse the signs of pigmentation. Vitamin C is a great one to use. That'll really help, and it's tolerated really well by most people. Retinols will work. There's the Zoe skin brightening retinol is amazing. That works so well. I'll find you before and after I used it. I had such bad pigmentation after my little girl, and the result was amazing. It made such a difference. So there's lots of different things that you can use. It doesn't have to be something that's just going to be a retinol. You can use something a lot more gentle, and you'll still definitely get a difference. But people come in all the time, and we'll give them a skincare routine which will focus on a little bit of a more gentle approach if they don't feel okay with the retinol.
So I think a lot of messaging around SPF is obviously don't let your skin get sun damage because it's like irreversible, but it's not completely irreversible, isn't it not?
So the bit that's irreversible is, so with sun damage, the risk of that developing into something cancerous down the line.
Yep.
So 30 years time, there's no way that we can change what's happened in the skin. But in terms of how it looks and
Visually,
the visual bits that we see and the pigmentation, then that is absolutely reversible. So we can do lots of different treatments that can completely get rid of that. You can completely change someone's skin. That's the easy bit to do, but you can't change the long-term damage that is done internally. But we could, with product and with treatment, absolutely get rid of it.
Love that. Because it is annoying. I feel like I get that sort of like dark moustache now, but I cake myself in SPF and also wear a hat.
It could
So
be melasma though. So that's like hormonal pigmentation. So that's different.
It's never ending.
I know. So if you're feeling you're getting pigmentation that's like what we'd call like butterfly effect, so it mirrors on either side, there's a high chance that's melasma. And that's pigmentation caused by a hormonal change.
Right.
With melasma, so BBL is actually one of the only FDA approved machines to target that, and it works really, really well. Melasma can be managed, but there's no way to get rid of that totally because it could just come back with a hormonal change. But you can use machines like BBL to get rid of it.
Okay, that makes sense. Maybe let's just say that's what it is.
It probably is. If it's here, it tends to be here under the eye or here, like at the top of the forehead.
And it's just annoying. I feel like then when you've got your makeup and stuff on, it's really obvious.
I know, it looks
you do
really
look
dark,
like a dark moustache. When using new products and trying to work out if they're working for you, if they agree with your skin, I see quite a lot of you need to give it a month or give it time, obviously, like to work. Is that true?
Yeah. So, I mean, if you start using something and you can tell immediately that it's not agreeing with your skin over the next couple of days, that is fair enough to stop it. But if we think of a skin cycle, that's normally about 28 days, so a month. So I would normally say give it 4 to 6 weeks to make sure that you know if it's working or if it's not. Some can take even longer, it can be a little bit more of a process. But by a month, you should be able to see a positive difference in your skin because you're going to start getting that new skin come to the surface.
Okay. Because if I use a new serum or like something like that, and then I get a couple of random spots, I'm like, is it that serum? Should I stop? But I just don't know what to do.
I know, it is hard, and I think especially with people with problematic skin, they're so worried to try anything new.
Yeah,
so
in case it breaks it out.
It's not working for me. But you can also get products that make your skin purge a little bit to begin with. So it's hard to know and hard to find the balance. Anything that, I think people know themselves, anything that feels too much or a huge change and not in the right direction, then stop. But it should take about a month normally for you to start to see.
I think it's more if it's like stingy or stingy eyes, you think,
totally,
right, that's
you know
not
yourself
for me.
if you think this is not working.
Yeah.
Totally.
Okay, fab. Right, so products.
Yeah.
Specific products. Could be here all day.
I know, I've got a long list.
What would you recommend for the kind of colder months, winter months? People feel their skin gets drier, they want extra hydration. What's your key products for that?
Okay, so I've got a budget and then a splurge. So budget would be Cetoplast Balm. I think that's great for locking in moisture, making everything feel hydrated and plump, but it's not going to break the bank. My absolute ultimate best moisturiser is the SkinCeuticals Triple Lipid. It's so, so good. It's full of fatty acids, really, really hydrating. Honestly makes such a difference to patients with dry skin. I would say if you're looking for something that is a bit more of an investment, but something that's going to really make a big difference, that'd be one to go for.
Lovely. I love this like comparison here, because I do think you get to maybe an age and a point where you're like, right, it's worth spending money, but then other times you're like,
totally.
And
I think if
this on right now.
Dryness is your biggest concern, then great, that's something you're going to spend a little bit more on. Or if you're a little bit older, perfect. But if you are younger and you think, oh, I just need a good moisturiser, but I don't have particularly dry skin, or maybe got a bit more of an oily skin, you don't need to spend a fortune. Your skin's doing a lot of that work anyway for you, so you can buy something a little bit cheaper and spend on other areas if need be.
Perfect. And what would you say is a good entry point for retinols and vitamin C's, like the kind of stronger? What brands could we be looking at for that?
So there's lots that I really, really like. Vitamin C, this would be one I would say it's worth investing in. So the SkinCeuticals, again, their vitamin C is called CE Folic. It's the best one that you can get.
I've tried that and loved it.
It's so good. It is more expensive, but it is unreal, and the results are worth the price point, I would say. So I would say invest in that one. In terms of a retinol, SkinCeuticals actually do a more affordable retinol, which is a lower percentage. The one that I use is the Zoe Wrinkle and Texture Repair, and it's unbelievable, but it is a little bit more expensive. I think it's about £110.
Yeah.
But it lasts so well. I think it lasts about a year or so because you're using such a small amount. So cost per use, it's actually not too crazy. So they're sort of your ones when we're thinking of treatment products that are worth spending a little bit more on.
Yeah.
You can get cheaper retinols, but then the ingredients start to change a little bit, and is it really retinol that you're using or another form of retinol, and what percentage you're looking at. So I would tend to start spending a wee bit more on those types of products, and then saving on, say, my cleanser and my moisturiser, and like sandwich them in.
Because like The Ordinary and Inkey List and those sort of cheaper brands do retinols and things, and you just don't know.
I know a lot of them, it's like the percentage of the actual product, or they're using like a derivative, and you're like, oh, that's not actually the right thing that I should be putting on my skin.
Yeah.
And I think sometimes with The Ordinary, not so much now, I feel it's calmed down a little bit, but we used to get a lot of patients that would have problems because they would just kind of buy everything and put it all on and end up burning their skin.
Yeah.
So I think if you're using some of their products, that's fine. Like their glycolic toner is great.
Yeah.
Their HA is good. Like all of those little ones are absolutely fine sandwiching, but I think if you're going to use something that's really results driven, maybe spend
invest. Yeah. Makes sense. Must have products for pregnant women.
So
a lot of them obviously need to give up.
I know you have to give up. I know have to give up some bits. So I would say you want something that's, because pigmentation can be such a problem during pregnancy, but you can't use things like retinol or stronger products.
Yeah.
A good vitamin C, so you can invest in that, and then a nice moisturiser. You can, people when they're pregnant are often told, I can't use any acids or I can't use anything at all. Lots of people suffer from breakouts, especially in the first 3 months of pregnancy.
Yeah.
You can use acids, you just need to be specific in what you're using, but like a glycolic acid's absolutely fine to use, and can really help just to like calm a breakout down a little bit. But I think you want to be working on something that's going to brighten your skin, help to suppress pigmentation, so really good quality vitamin C, nice cleanser, and a nice calming moisturiser as well. You don't want to do anything too extreme or too different with your skin. You want to keep it pretty simple, I'd say.
Yeah. A few people asking for cheaper alternatives to like Zoe, SkinCeuticals. Like what other brands could we be looking at that are maybe a bit more affordable?
So one of our reasons for getting Biologique Recherche is so that it's a Parisian brand and they're incredible. Hailey Bieber's always banging on about them, and they are
fine. We'll get it.
I know. I'm like, fine, okay. If I'm gonna look like her, I'll do it. And it is great. And some of their products are more expensive, and some of them are more reasonable. So they have a lot of kind of in between products, which I think are great, that aren't as dear. I think I actually tend to go a little bit more old school, and I go for La Roche-Posay and Avène. I think both of them are excellent brands to use. La Roche-Posay has so much research behind it, really, really good products, and they do really, really nice cleansers, and they cater for all skin types as well. So I would actually go for La Roche-Posay or Avène in terms of a cheaper price point. Things like The Ordinary and Bioma and things, I think they're all good, but I probably haven't used them enough to say this is exactly what I would go for, whereas I feel really confident with La Roche-Posay and with Avène as well. Their products are great, they're really safe, they're effective, and there's still a huge amount of data behind them.
Yeah. I just think La Roche-Posay have got product after product these days.
I know.
The range is massive.
It is huge, and it is kind of maybe a bit of one to kind of get your head round, but they have some amazing key products, and if you look into the company and into the research that's done behind each product they launch, it is a really, really impressive amount of research that they're doing. So I think that's something that's really important when you're looking at products and thinking, is that just sort of a trend or something that just sort of pops up and appears on Instagram? You want to make sure it's something that's actually sort of clinically backed.
Yeah, because TikTok,
I know,
and it just drive you down the complete wrong path.
Totally, and some people show me some of the things that they've got or where they saw advertised.
I know, just don't listen to TikTok when it comes to skin and health.
Yeah, exactly, I know, that's it.
They're not qualified.
No, they're not qualified, and I had some of this stuff that people will tell me. I'm like, no, wait, show me the video, that can't be right. And I'm like, oh no, they did say that. But
the other problem is people just believe it.
Totally.
Like people coming into you and saying that, my question would be, why are you believing that?
I know, I'm like, that's not the case. But I think, like, go for something that has been around for a while. Do you know, it's got a lot of research behind it, and brands that you know and you've heard of is normally a good sign. Some random product from Instagram, if lots of people aren't using it that you know, and in your age group, that is probably a sign that's maybe not the best thing to start.
Yeah. Product recommendations for like acne, eczema, dermatitis. Is there any specific ones for any of those concerns that product-wise you do see results from?
I think they're ultra, especially like eczema and dermatitis, they're tricky because they are something that can be so reactive. So you have to be really, really careful what you're putting on them. With like perioral dermatitis, there's a huge rise in that over the last few years, and a lot of the time it does need medication. You can control it with products, but you want to use nothing active on it, so really kind, really gentle products. A lot of people use like an antimicrobial spray on it, which does work well. With eczema, again, you want to be using such gentle, really natural products. You don't want anything too harsh on it. With acne, not that you won't... With acne, big things, I'd say avoid alcohol-based products completely. And then use things that are going to target the acne. So if we think of what is in acne, it's P bacteria that we want to target. You need to use like a salicylic acid to get on top of that. Ones that I do really, really rate is a lot of the Zoe range. I think is amazing for acne.
Yeah.
Again, if you want a bit of a cheaper price point, you can look at things like Avène. They have a really good range, and it will help to get on top of the breakouts. It might take a wee bit longer, but you will get there. Or invest in like 2 products from Zoe and get the rest from Avène or from another brand, and that'll work really well. We actually use a lot of the biologic recharge for patients with eczema because it is so natural, and that works really, really nicely. But I think, like with dermatitis, a lot of the time we'll need to be using a medication to manage that alongside a really gentle product routine. So it can be a little bit tricky to find what's working for you, but my main thing would be strip it all back and keep it super simple.
Because I've always found, as someone who has had acne but also still gets like the odd spot here and there, I just always want to reach for like a anti-blemish gel that you just put on like your spot.
Yeah.
But shan't any of them work?
It depends what's in them. So like if you're thinking of like benzoyl peroxide, like that's going to work for spots and killing the bacteria in a spot. So you can get really targeted treatments that do help. Like Murad do one, a spot control gel, which I actually do think is good as well. But
what was the one I used that I actually found really good? The Malin and Goats?
Yeah.
Little... You go through the oil into the formula kind of thing, and then you put it on with a little cotton bud. And it did kind of, if you catch it early enough, stops it from coming. But
Yeah.
I think the thing that I find with spots is it's an internal
Totally.
thing.
Like,
So it's like, even all these things, they might help dry it out quicker or whatever, but it's the root of the problem you need to get under control.
a lot of it is systemic, so it's something inside the body that is causing those breakouts. But what you could do is, like, niacinamide's great for bringing down the inflammation and the redness, so you could use something like that to improve the appearance of the breakout. But sometimes it can be, you know, it's coming whether or not you like it or not, sort of thing. So it's it can be really difficult to get on top of it. But I think if you're thinking of like key ingredients, not so much brands, you're looking for glycolic acid, salicylic acid, niacinamide, they're all going to help to get on top of the breakouts and to calm them down a little bit. But a lot of the time we need to look at systemically what is causing it.
Yeah. Okay, cool. And what about the hype around all these gadgets, like LED masks, the new face, the kind of tightening tool? What's your thoughts on them?
So I think an LED mask is great. It's good for anti-aging. It's good for calming inflammation in the skin. I think, annoyingly, it does kind of... there is a bit of a link between how much you're spending and how effective they are. I mean, the ones that we have in clinic are thousands and thousands of pounds, and they do work really well. And then you think, how can something that's a fraction of the price be giving the same result at home? But I think they are worth using. I like the Current Body one, I like the Dennis Gross one, and I like the MZ Skin one. They're all really good, and I'd say worth investing in. Some of the cheaper ones, I think, I just don't know how much of a result you're getting out of them. So I think it varies. I think it also varies in terms of commitment from the patient. We have people that use them religiously every night and notice a big difference. The Lima laser as well, we have that, and that is really, really good. The price point, though, I think is about £2,000 or £2,500 maybe, I can't remember, but that works amazingly. We have some patients that have bought it and committed to using it every night, and like, it makes a huge difference to my skin. So I do think they are good, but again, sometimes I think it just depends where you want to put your spend. Like, do you want to invest in that or do a few more treatments in clinic and like, do you know, work on the same outcomes? But I do think they are good. I don't think they're a gimmick. I do think some things can be a little bit gimmicky, and again, I'm absolutely influenced by what I see on Instagram and think I want that, and then I'm like, why have I bought this? But the new face, again, so that's going to be like stimulation for tightening. That's good. Again, though, you do have to use it continuously to see results. We do have patients that really commit to it and use it, and they notice a big difference. Other patients, if you're not using it religiously, they're like, I don't really see the effect. So it's something you have to be consistent with for sure. But these things do work. But if you know you're not going to do it every single night, I would say don't invest in it. I'm just never jumping into bed and thinking, let me get my mask out. Like, I'm getting cozy and comfy. I know it's 15 minutes or 10 minutes, whatever it is. It's uncomfortable. I know.
I can't open my eyes and look at my phone, so it's uncomfortable.
I know. I always think of Sophie Habu, like, anytime you see any video.
I was just thinking about her.
I'm like, wow, she's so committed. She's always got a device.
She's always got a device. I was just thinking the exact same.
Always, Jamie Lang, like, post the video of her watching something on TV. Did you see that? And she's like...
And she's just always sitting with that device.
I'm like, oh, that's why you look like that.
Over a mask, like hair mask, and you can tell like the full shebang's going on.
Totally.
No wonder she looks that good.
I know, exactly. She is committed, totally.
A few, to finish, just questions about your products, like what you love, what you use.
Yeah.
So, what's your must-have product, one product that you use that you think everyone should be using?
Oh. My goodness, got like four of them. Like, I would say, I'm going to go the SkinCeuticals Vitamin C. I think that using that is one of the biggest differences I've ever seen in my skin.
Okay, I need to get back on that because I'd enjoy it at the time, actually.
Yeah.
And 3 products that if you were on a desert island you would take.
Okay. So, I mean, I'm very ginger and wouldn't be good in the sun. So, I'm going to take a good cleanser. So, I would take the Zoe cleanser for sure, and then so that's exfoliating cleanser I would pick. Then it's so good, isn't it? Then I would take the SkinCeuticals Vitamin C, and I would take the Heliocare tinted SPF 50.
That's a good combination.
My bonus one, if I could, would be Biologic Research P50 because it's so good.
If you could sneak it in the
If I
pocket.
could just put it in my sock and go. That one's really good too.
I think it's funny we ask these questions when if you're on a desert island, like there's a lot more important things.
I know. I
But
might be like,
I don't know,
my
is there?
SPF. I know, probably not. No.
As long as we're
Nothing else to do.
protected, it's fine.
Exactly, we're fine. Someone will rescue me.
Be starving, but our skin's
Exactly. I'd be really
tanned and not
skinny and I'd be my face would be looking good.
Well, thank you so much for coming on.
Thanks for having me. It's been so nice. Loved it.
Loved it. It's been so fun. Round 2.
I
When you
know.
get back for round 3 next season.
Absolutely. Sign me up.
Well, thanks, and good luck with all your new treatments, your new openings.
Thanks so much.
Hopefully loads of our listeners will get in.
Absolutely. I've got a discount for them.
Love it.
If they put in their booking reference a lot on your plate, then they get 15% off their first facial.
Love that for
they can
them.
all I know they can all book that in.
Amazing. Thank you.
Not at all. Thanks for having me.
Thanks so much for watching, listening as always, and please remember to check out Fiona's page on Instagram at the Aesthetics Club, and if you've not had a facial with her yet, please go and do so and use a lot on your plate in your booking confirmation for 15% off. Bye!